Welcome back to Startup Health Now, where we celebrate the entrepreneurs and innovators transforming health. My name is Unity Stoakes, co-founder of Startup Health, and really super stoked because today we're going to discover how our community member, Suggestic, is turning food into a powerful therapeutic tool. I recently sat down with co-founders Shai, Rosen, and Carver to unpack their innovative approach to personalized nutrition and wellness technology. We go deep, dig into their respective journeys, Carver's roots in medical equipment and Shai's transition from aspiring doctor to tech innovator, what I like to call a doctorpreneur. The duo shares how they're bridging the gap between food and medicine through the power of AI solutions. We also talk about something that I think is relevant to a lot of health innovators today, but their pivot to a B2B business model. And it really reveals how their shrewd understanding of the market led them to find a new approach to scaling their impact. So, are you ready? Let's do it. Stick around, it's gonna be a great show. So, welcome Carver Anderson, CEO of Suggestic. Let's start with you. Tell me about your background. I know you're from Minnesota. I know you worked at a lot of amazing places before, United Healthcare Group and others, but you're the CEO and of this amazing new company that's part of our Food is Medicine moonshot. But tell us a little bit about you. I want to hear about your origin story and your background.
Yeah, thanks for having me. Yeah, so I always like to start way back just because it's relevant. My parents were in the medical industry. They started a medical equipment manufacturing company in the cardiopulmonary diagnostic space. So when I was a child, the basement was full of medical equipment as they were trying to get this company to market. And my mom ended up being one of the first, I think the first woman in Minnesota to bring a company public. So it was quite an upbringing and seeing all of that happening. I went to school, electrical engineering. When I graduated, which was I'll age myself here, I graduated in '98. The software industry was on a tear, and so I didn't go strictly to engineering. It was more software development. So I started my career out as a software developer, full stack, which I think provided a really great foundation for what I've done since then. I got my MBA around 2003, 2004, and still hadn't gotten into healthcare myself yet. I went immediately to Wall Street, did some management consulting there in technology, and it wasn't until the end of that where I finally caught the bug, where I do something that was more mission driven, and the healthcare thing is in my blood, and so I started working for a couple different medical device companies, and on the side started a company called Mind Body Green. That was one of the first digital brands out there. A lot of things that are mainstream now. Holistic health, East meets West. So that was a really great education for years of meeting everybody in the wellness space. We had annual events where we would invite influencers down for a long weekend at a resort outside of Tucson. So it was this really great experience, met a lot of folks, and then since then went on to G Ventures, which doesn't exist anymore, but ended up leading product and sitting on the executive team of a company called Level 2, which is a type 2 diabetes platform, a type 2 diabetes reversal platform. UHC acquiring that. And what really drew me to Suggestic as a next step was the fact that most of the effort involved in Level 2 was not in magic, and level two was in the program, right? Like where do our members start? Stones, what are the phases of care? How do we get them to a good outcome? Their type 2 diabetes, which was a novel concept when we were starting. And biggest problem was the technology. It kept holding us back. We were building all of these things from scratch that extended from what it could have been. So when I learned that Suggestic was out there, and I could, people in my former position, avoid that there can be magic in technology, and Suggestic has created that. But for people with a concept for a health program, they shouldn't have to worry about the technology. Their magic is in the delivery of their program, and Suggestic enables that. So yeah, I'll pause there because that was a
Let's pause there, and I want to loop in Shai Rosen, who's joining, co-founder of Suggestic. Shai, how you doing?
I'm doing
Uh,
good. How are you?
we were just hearing Carver's origin story, just a bit of background on him, and I want to do the same for you because I think you have an extraordinary background too. Just
Sure.
getting to know you and your origin story, and then we'll shift gears after that and kind of dig into what you both are building now with Suggestic and kind of the magic there. But Shai, tell us about you. Tell us about yourself.
Yeah. Let's see. Where should I start? So, originally from Israel, grew up in Latin America. Always growing up, always super interested in health and wellness. Wanted to be a doctor. Went to med school. Dropped out after a year. Said, this is really not for me. Um, Parallel story. I started, programming and developing software just as a hobby when as a teenager. I kind of grew with a computer in front of me. And that was kind of the natural fallback for me, just to go into engineering. I think I always had a kind of entrepreneurial mind or way of being. So started my first company while in college, first, second, whatever. Eventually, that led me to move to Mexico. Mexico, met my original co-founder, which is Victor. He's not longer at Suggestic anymore. And was living in Mexico at the time as well. So we met. We were both. I had sold my previous company and was, in this process of, I'm not in a hurry to go anywhere. I didn't make enough money to retire, but I can take a couple of months to think really what I want to do next. It was a very intense couple of years in the previous company. And kind of naturally, the passion about health and wellness kind of it never disappeared, right? So I was being sort of on my own, doing my own thing. But that came up very naturally of, okay, let's do something related to this industry. We knew very early on that we wanted to do something that was a important impact in people's health, but without necessarily having to deal with the healthcare industry or, the typical thing or that we used to see back then. I'm talking about 11 years ago. Would be, companies like startups doing, I don't know, like machine learning analysis on billables and reimbursements and those kind of things. Like that's it doesn't
All the administrative stuff.
exactly. It's interesting in the healthcare industry, but it doesn't really affect anyone's health. Or maybe yes, but
Yeah.
very downstream. And in terms of like personal background, both my co-founder and I, we've been learning about like integrative health and functional health or medicine and all these kind of things. So we said, okay, now how do we take all these different concepts and apply basically this? What everyone was talking about back then was this idea of do you call it? Was a personal medicine as a precision medicine. Right, so it was this Obama initiative around cancer. So we say, can we take the same principles, use machine learning and AI, just to apply the same, but for preventative medicine and for wellness and for nutrition, right? Which is sort of the biggest component, the most complex component on all of those, and the one thing that we believe has the most impact in health. Say that like everyone cares so much about like a pill that you put in your mouth once a day, but you put in food in your mouth like multiple times a day. So,
Right.
And in much larger volumes. And it's basically, if you look at it from basically also molecules and chemicals that you put inside you, it's exactly the same thing. maybe less concentrated on some categories, but it's really no different. So that's kind of where the whole idea was born. We took this to the health.
And how many years back did you start Suggestic?
10 years ago, in 2014.
10 years, okay.
Oh, 11 now, 2014.
So it sounds like you were both had these inflection points that I think is really interesting. Carver, you obviously from a very young age, your parents build in med tech, and your mother take a company public, and then everything you saw at United Healthcare, and your own experience building in the wellness space, and then Shai, you as a serial entrepreneur and innovator. You both had these inflection points, and then how did you both meet and come together? Because I think one of the things that so many people always wonder is, how do teams merge? How do they meet? How do you get started? Where's the magic? Because it's really about mixing people, purpose, and vision, and then you can do these extraordinary things. So, Shai, you had this platform with Suggestic that you were building, and then you guys met up. How did that come about?
Yeah, I think that was about a year and a half ago. Carver, you know the story better, how you met Victor.
Well, it was Victor, Shai's co-founder, had identified me on, LinkedIn, and just reached out and was, I think, probably curious about experience with level 2 and how level 2 could have and should have probably been a very good customer of Suggestic if the decisions had been made differently early in the days of level 2. And we just started a dialogue, right? It was, very long, sort of, a few phone calls, and then, as UHC started taking over the operations at level 2, I started just doing some quick projects with Victor, talking about just different concepts with the platform and how to really maximize the use of AI within the platform. And so that led to short-term engagements that just kind of got extended and eventually into a full-time capacity. So obviously I met Shai very early on in that process. And so I've just gotten, deeper in over time. And I think there's just such an opportunity these days with the confluence of, what the technology can actually do in terms of being able to personalize to individuals, and the growing expectation from consumers that they want that level of personalization. I think there's just such incredible opportunity right now. So.
Well, let's dig into Suggestic, because I'm really excited and grateful that you guys are part of the Food is Medicine Moonshot, and I think the mission you're on is significant, and I also think your approach. So let's just start with Suggestic and how you describe what it is, so the world can understand this. I know you're enabling health brands and other big companies to deliver personalized nutrition and wellness programs, and you're really creating a platform so others can then do this at scale. But how do you guys define or describe what Suggestic is, what it's evolving to become, and where it goes?
Sure, because I have a lot of background for that answer.
Yeah, and sometimes your legacy way of thinking about something, it's over so many iterations and so many years, and then where it's going is also a new birth for the future. So I totally understand that. But maybe just at the highest level, I mean, what do you care about? Why do you feel that? I mean, I've heard from both of you the word leveraging technology in useful ways to do something that impacts people's health and well-being. This is not an administrative platform. This is not a tool set that's just kind of moving peas around. You're really trying to impact, I think, people's wellness and well-being, and you're coming at it. Some people are building a brand to go direct to consumer, for example. I think you have a unique approach. How do you think about all those things?
So that's actually a good point to pick it up. So the first half of the history of the company, so it's exactly half now, like first 5-6 years, were focused on direct to consumer. So we created a direct to consumer product. It was a mobile app. We did relatively well. It was maybe a bit too complex for its time, or too sophisticated for when people, in their mind, nutrition was, Weight Watchers and counting points. And we kind of came up with this more personalized idea and connected our wearables and devices and lab tests. And but at the same time, also what we understood over that period of time is that our strengths as an organization, and again, Victor and mine as founders, were in building product and building technology and being innovators. We were not great at marketing and talking to people. So we found ourselves at an inflection point when we said, how do we grow from here? Do we really, want to pivot towards more of a marketing focused company, and we just, create a whole marketing group and, raise a lot of money to just basically spend on advertising to grow on consumer? And at the same time, we were approached by United Healthcare. They were running their first acceleration program for startups together with Techstars. So they invited out. They said, listen, nutrition is super important for us for the next couple of years. We've been looking at what you guys are doing, and we think it's one of the most interesting propositions in the market. You're also not too big, so we can kind of go around for what we want to do. They were very transparent in that. And we said, yeah, we're this right moment, we're in an inflection point trying to find ourselves. We decided to join, and that's where we decided to pivot to B2B. It made sense to us. It's like, if there's organizations that already have the consumers and have the people, we can sort of manifest our vision or help do that via these organizations that already have the contact and the relationship with the patient or with the consumer.
So you basically have a platform or enable other businesses. They can white label their solutions and take it out to
Exactly.
be either their customer base, their employees, their
Exactly.
I guess their audience in a way. And Carver, you talked about this earlier. Instead of having to start from day zero, build your own tech stack, you guys are creating a solution that just almost cuts that whole cycle out of the loop, that you can just instant on, and now organizations can have their own platform that directly helps people with personalized nutrition, personalized meal plans, personalized medicine. Is that kind of, am I in the right ballpark here?
Yeah, that's correct. And that kind of gets to the why of what it is we do. I think to really affect health, we're going to need a lot of people working and in various capacities and in different angles. Every individual is different. One program might work for one person, but not for another, and that's okay. I don't think we're ever going to have some globally applicable solution for health, right? I really think we're going to need so many people working on this. So that's our belief, is that diverse evidence-based approaches to health and wellness should be accessible to all people. So, and that's our vision and our mission: creating a world where personalized care can transform lives at scale. And so through our platform, it is agnostic to program. We're trying to provide as a platform that can get these programs to market quickly and in an efficient way. Like literally, if a client has their vision crisp and their content and certain things in order, we can get them to market in weeks. Whereas it would take them 2 years to build this stuff on their own, and a lot of invested money and wasted time, frankly. So we can get these solutions out to users, validate that what they're doing is right. The magic for them is in their program and their approach, not in the technology. We can be their partner in making that a magical experience through the technology. They don't have to worry about that. They worry about the program and their members or their consumers or their patients, and we partner with them on the technology.
That's awesome. Both of you have interesting experiences in your journey. I'm wondering how critical or helpful those have been in terms of informing your current business model and where you're taking Suggestic. So, Carver, you coming from the United kind of lens and really understanding the economics, the business models, maybe how at scale the market is looking at this. And Shai, I think your having gone through that experience of going direct to consumer, having, had to build over months or years, and how long that process takes, and realizing, gosh, there's got to be a better way for, all these companies trying to do that, and maybe a different approach to the business model. How did those previous set of experiences from both of you, how are you leveraging them to inform where you're going? And I'm sure there were some hard-earned lessons along the way. And what are some of those?
I think from my perspective, it's very clear, which is that background helps us when we're developing product or defining product or thinking about what we want to make available for our clients. We always think patient first or user first. We don't think client first or company first, right? So I think that's the biggest difference or biggest approach. We see a lot of there's not a lot of direct competition, but again, in the space, in general, in B2B, the who pays wins, right? And then that's usually the company and not the end user. So a lot of what we do is try to focus on that end user, and eventually, obviously, it all goes back, and the company ends up having more value because of that, because the users end up loving their products. And you can see, like, if you open in the app store, I mean, that's the easiest way to see it. Go to most companies, especially in healthcare, and they'll have like 1 star, 2 stars. Go to our clients and you'll see 4, 5, 4.8, 4.7, just because we're very focused on creating a good user experience.
Yeah, and just to go further than that, maybe a little bit more fundamentally, I think you hear folks like Dr. Mark Hyman, for example, is always talking about how we don't have healthcare in this country. At least we don't have healthcare, we have sick care. The system is all built to manage disease that's already there. And I think we all believe that we can do better. And so while we focus more upstream, I think the vision is that we can keep people out of the system, right? Like that's the I think ultimate vision is, through this work with our clients, own and stay out, and head off disease before it starts. Our platform is certainly applicable to disease state management, but I think where we tend to partner most is with more further upstream. So weight loss programs, metabolic health, gastrointestinal health, fitness, nutrition, things that are going to keep people healthy and out of the system is what I think, at least my personal vision, is for.
It seems like there's in this new world of GLP-1s, but also more than that, there seems to be a new understanding or awareness of the value of food as medicine, nutrition in general, lifestyle, prevention, all of these things kind of colliding in a very productive way at this moment. It seems like, from what I'm hearing from both of you, you're infusing these fundamentally into the DNA of the business and the solution you're creating. How is today's moment of building in this category and building the way you are different than, say, even 5 years or 10 years ago, when there wasn't even a GLP-1 category? Probably when you were doing the is it Mind Body Green? Different experience completely than where the market is today. It seems like it's matured. It seems like the future is vast. How do you both see the opportunity moving forward because of these, all these different things happening?
Yeah, the way I think about it is, a few years ago I read a book called The Age of Scientific Wellness. It was by Leroy Hood, who was an innovator in the whole DNA space, and Dr. Nathan Price, who's now at Thorne. They had this vision years ago. And, I think what they did is articulate a lot of what I was thinking through all my experiences, through, the medical device work and through the Mind Body Green years. The way that we're going to get to, a true state of prevention and true health is is through extreme personalization, right? Like this, everything should feel like it's extremely custom to the individual, because that is when it works. And there's so many things involved in that, not just physiology, but the way that you might approach behavior change, environmental factors, socioeconomic, right? Like there's so many things that make an individual that the care should be able to adapt, or not care, or the prevention program, whatever it is, should be adaptable at a very high level to individuals. And what we didn't have 3 years ago was generative AI. It was there, of course, but now it really has exploded. The team at Suggestic has been working with AI for longer than the existence of ChatGPT. But now that it's really in the zeitgeist, I think that, along with, again, I mentioned this before, consumers' expectations around this, right? They're getting a taste of it through, all of these different things that they're sampling, different programs out there, wearable devices. They are sampling it, but they're really not getting a true taste, like a full taste yet. And so that's where I think we're just scratching the surface on bringing true personalization to the market. Suggestic platform, and the other area that we specialize in is AI transformation. So because we built a platform to bring AI into our platform, we also help clients with their custom AI initiatives. So bringing those all together, I think we have a real opportunity here. We have demand and we have capability, technical capability, and I think we're just seeing the beginning of what we can do to really, create special experiences that are truly personalized.
That's really exciting, because what I'm hearing is now there's potential for scale. There's a real business here, which means it's not only sustainable, but the opportunity to scale. And given the focus of what you're trying to scale, that's where impact will really happen, in terms of not only better outcomes, but hopefully helping people be healthier along their life journey. So it's really, really exciting. Just walk me into the future, impact, wave a magic wand. What is Suggestic? How have you impacted the world? Take us out however far you want, but what's your dream? What's your moonshot vision? However you want to define that.
Shai, you're still on mute. Yeah, I was going to say, it looks like you have a good one there.
I mean, there's no specific reason for it, but we've always thought of this like, okay, let's reach the first million active users. So we're tracking in the right direction. It's a little bit of a vanity thing, but it also has to do with impact, right? So obviously there's impact in affecting one person's health. I'm not minimizing that, but this idea of like, okay, there's significant impact. So that like million mark is something that has stuck in my mind for many years.
Yeah, there's always this, what I'm hearing from both of you, this word scale, and using your platform to reach greater scale, I think, is a recurring theme here. Carver, you were going to say something.
Yeah, no, I think there's some organizations out there that are doing really special, groundbreaking things. Verta Health is one that I've been following for a very long time.
That's another startup health company.
Oh, great. Okay, I didn't even know that. Yeah, so Sammy has done, Inkinen, he's done an amazing job at being really aggressive and proactive and pushing the boundaries of what a company like that can be. At level 2, obviously, I was aware of them as a competitor to what we were doing, but I was just so follow him. He's been such a good advocate for reversal, and he's very boisterous and out there about, his leadership style is great. I think what they're doing is awesome for the members they serve. I think for me, it's, my vision is to take the special sauce of what they're doing, extend that across all conditions, all populations. That's really it. It's accessibility. So what they've developed is amazing, and the value of their company reflects that. That really only works for what they're doing now. I think there's some things we can take and bring that to much broader populations. And so that's again the scale thing, the more people we can touch with this personalization, and it's kind of more of a mindset too, right? It's not just technology, it's building a new mindset around what individual responsibility is for health. Then we can really leave a lasting impact.
I love it. So last question, your views on collaboration, collaborative innovation, working in a kind of community like Startup Health. Obviously, you're relatively new here to the community, but we're so excited to have you be a part of this. What are your own views on the opportunity with collaborative innovation, being part of Startup Health, being part of a food is medicine moonshot? Any quick thoughts there?
So first of all, I mean, what it's worth, I've known personally Victor Penem for many years. I've known of this organization for a long time because I've known that he's been a part of it, and we kind of trust him a lot in that sense of like when he said like, okay, it's gonna be valuable, you should be a part. I was like, okay, let's do it, right? So I mean, that's just to start there. That there's a lot of like we trust what Victor says. He's been around for a long time. Also, he understands the market and the places that have value. So if he said there's value here, we're going with that. That's one thing I wanted to mention. I don't know, Carver, what else you wanted to bring in, but I think that's
I mean, for us, awareness is the biggest roadblock to what we're doing, right? I think there are so many organizations that can benefit from what we have. Like I said, I mean, I know this firsthand. I wasn't at level 2 when the decision was made to build. If I was, I'm not sure I would have had the foresight to go and look and identify a Suggestic. It's kind of a niche. So it's really awareness. And so I think, being part of an organization like this is hopefully we can get our message out and get it in front of more people. But on the aspect of collaboration, absolutely. We collaborate with other organizations and individuals, and people that are more strategic focused and maybe have tools. We're all about collaboration. It's about having the ultimate platform that can service these potential clients of ours. So we don't have any ego about it. It has to be built in house. If it makes the experience better, then we consider it. So I definitely look forward to opportunities to collaborate with other folks in the organization.
Well, we love what you're doing at Suggestic, and very excited for the world to learn more about and be more aware about what you're building as well. So let's make that happen. Thank you both, Shai and Carver, for everything you're doing, and thank you for being health transformers.
Thank you.
And finally, an invitation to all of the extraordinary health transformers, whether you are a startup, someone building the future of health, or whether you are an investor, funder, or buyer of the solutions out there in the marketplace. This is an invitation to you to join the Startup Health member community. Learn more at startuphealth.com. Look forward to hopefully seeing you soon.